Hello, Core 4 Momentum Tribe. My name is Jessica Thompson. I am a doctor of physical therapy who is passionate about women's health and pelvic health. And welcome to our Core 4 Momentum podcast. Today, I have the honor of interviewing Dr. Katherine Sylvester. She is a pelvic health PT based out of Macon, Georgia. And in her practice, she specializes in helping women thrive through motherhood and rediscover their music. Music being an acronym for muscle flexibility, urinary continence. Watch, I get this right, Katherine. Sexual fulfillment, internal confidence, as well as core stability.
You got it.
Yay! Thank you for joining us, Katherine.
Thank you for having me.
We're
And congratulations to you.
Thank you so much.
Dr. Thompson, yes.
I recently graduated, you guys, so that's why she's congratulating me. Thank you, Katherine.
You're welcome.
Oh my goodness. So in today's episode, we're going to cover C-sections, and Katherine works with a lot of women pre-C-section and after C-section. So she's very well educated on this topic, and she knows more than me. So this is why I chose to interview her. So how's it going, Katherine?
It's going fantastic. Thank you for asking.
Oh, no problem. So let's just get right into it. So could you just give us a brief description? I know that I'm a twin and my mother had me vaginally. I was born first, and she had my sisters through a C-section. And I always thought that was weird, and I never knew what the C even stood for in C-section. So can you tell our listeners, like, what's the C-section?
It's such a good question, and it's funny because I got curious about where cesarean came from, and there are so many different. You don't even want to hear all the different theories, but C stands for cesarean. A cesarean section is when a baby is delivered through the abdomen instead of coming out through the vagina. Now, it's funny because when you look up the definition for a C-section, that's about what it says. Basically, a cut is made in the abdomen and in the uterus, and then the baby is delivered. But what I think that people should know, number one, is that a C-section is an operation. It's a surgery. And so there are surgical precautions. There are things to be aware of afterwards. There are ways to prepare for the surgery. The cut, even though you go from abdomen to uterus in the definition, there are actually 6 layers that are cut to get to the uterus. And so I think that before moms even have a C-section, if they know that they're going to have it, if it's planned and not emergent, right, then they should watch a video. And I have a video that I recommend that moms watch, because then you can see the skin is cut, the fat is cut. There's a layer that separates basically it covers up the abdominal wall, the abs. That is cut. The abs are separated. And then there is another layer that separates the abs from the stomach cavity. They cut that layer. Then once that's open, then they cut the layer of tissue that's over the uterus. And then after they open that up, then they can actually make the incision in the uterus. Then they get the baby out, and then they close up all of those layers. So you think about all of that scar tissue, right? Because every layer that was cut has to be put back together. And then you think about the abdominal muscle itself and how much it stretches to accommodate babies in your mom's case, right? Yes. And then for someone to go in and separate that tissue and clamp it so that they can safely retrieve the baby from the uterus. It's a lot. And so when someone says, what is a C-section? The textbook definition does not tell the whole story. So that's what I would say.
Oh, wow. Thank you for breaking down the anatomy, because that's how my brain works. And when you because you think about, you see this one scar, this one line. So you don't think about all those layers that you have to go through. So
absolutely,
that definitely puts it in perspective for me and makes it, and I like that you highlighted that it's a surgery, it's an operation, and it's serious. Mm-hmm. Because I think C-sections are so common. About 1 in 3 births in the U.S. are C-sections, right? So, you hear this and it's like, oh, she had a C-section, no big deal. But it is a big deal.
Yes. Yeah, I
Okay.
agree.
So, I mean, I know my mom had to have a C-section with my sister and not me. I mean, what kind of things put women in increase their risk for having to have a C-section?
That's a really good question. And to be honest with you, so there are a few things that increase their risk, but what I would say is that I see so many moms who they have a C-section the first time. So then they're just, as soon as they get pregnant the second time, the first visit they go in, the doctor is like, okay, when we're going to schedule your next C-section and we'll let you know the date, when it's a
Mm.
little bit closer or whatever to the time. And I just think there are so many C-sections that could be avoided if the first conversation was, do you want to have another C-section? Would you like to try a vaginal birth? Because I feel like there are things like, okay, if the placenta is over the cervix, so the uterus is up here, at the bottom is the opening for the cervix into the vagina so that the baby can come out, right? So if the
Mhm.
placenta is on top of that opening, then probably have to have a C-section, right? Or if the umbilical cord goes down through the cervix, and you don't want to put the baby at risk. So if the baby's going to be at risk, or if the mom's health is at risk, you think about moms who they end up having high blood pressure during their pregnancy, and so their blood pressure goes up. And if it's really, really high, then it can result in something called eclampsia, where a mom has seizures. And so if a mom is going to seize, then they're not going to, they're going to go ahead and get the baby out, save the mother's life. Or if the baby is going without oxygen, then, you got to get the baby out. And so there are emergent situations, but a lot of the times it's not an emergency. And I was looking at some of the research, and they were talking about how with the fetal heart monitor, it's like the more we know, the more we want to intervene. That's the way I feel. And so
Mhm.
if you watch what's happening to a baby's physiology, so you're looking at the heart rate, and the heart rate's going up or it's going down or it's getting slower or it's erratic, then sometimes they'll say, we gotta get the baby out, it's not safe. But research shows that about 50% of the time, what looks like is pathological actually is not. It's a false positive. But
Wow.
C-sections are done, right? Because we are in a sue happy country. And so doctors are afraid to be sued. And so they'd rather protect themselves, I think. And, because they do have a lot of good outcomes with C-sections, they feel like, well, this is the better way to safely get the baby out and preserve the mom's health. But I feel like a conversation should be had. So with me, I did develop high blood pressure during this last pregnancy, and I know that if I were in the hospital, it would have resulted in a C-section. But because I had my baby at home, I didn't have that issue. I mean, we just pushed through and it helped. It worked. And then you think about induction. So I was induced, but I was induced at home. And I was induced with a sweep of my membrane. So she swept my cervix to kind of get things going.
Mhm.
Whereas in the hospital, sometimes let's say that you're induced with medication, and then the contractions like really, really speed up. And then the baby ends up lacking oxygen because of how fast the contractions are coming. Or, I mean, it could be anything. So then 25% of inductions end in a C-section. And so it's like, do you really want to be induced? And I feel like that number is higher. I really do. But I know that that's the last statistic that I read. So and I think that's probably first time moms. But I just feel like there are emergent situations where I think C-sections are warranted. And then I also believe that some of it is out of convenience. I remember talking with a
Mhm.
lady who used to be an OB, and she said that she really did. She got to the point where it was better to schedule. So especially around the holidays, so that she could kind of know what her schedule was and everything. And she said, but once she started thinking that way, she went ahead and walked away from it because she realized that she was putting her convenience over the health of her mothers. And I feel that when you give a mom that option, or if you scare her and say, you know what, the scar in your uterus could rupture, because that is an indication for a C-section, right? If the
Mhm.
uterus ruptures, what's there to support the baby, right? You got to get the baby out at that point. And so if you tell that to a mom, moms instinctively protect their children, right? And
It's
so if
natural.
they're told something bad is going to happen to my child, then they would rather just go through the surgery than try for a vaginal delivery, right? But the fact of the matter is that uterine ruptures are not common. And so it's like you're trying you're avoiding something that is probably not going to happen, right? And so then you end up having a C-section because someone suggested it. And That it makes me, I guess it's so frustrating because when you talk to moms in retrospect, they're like, I wish I had tried for a VBAC. I wish I had known what a vaginal birth after cesarean section was. Like no one even talked to them about it or brought it up. And I think that's the part that's not right. We should have a choice.
Wow.
And the choice should be an informed decision, not that you're scared into making a decision. Right. Oh, and then another indication, sorry for a C-section, because that's what you started out asking me, was
No, I'm loving
the
this.
position, is the position of the baby. So if the baby's not in a good position, which sometimes happens with multiples, the first one might be head down and perfectly positioned to come out, and the second one's got the feet down or the butt down or whatever, and so it's not going to work. And so, but what's really neat is that if a baby, so the baby's supposed to turn, let's say by 30 weeks, should be head down. And if they're not head down, because I'm trying to think of the statistics, but at 30 weeks, majority of babies are head down. But if they're not, they still have time to become head down by the time the baby delivers. So about maybe 3 out of every 100 are not head down. So they're not in the right position. But at 37 weeks, it's safe for them to try to turn the baby. And so you could try to turn the baby externally. So I feel like if I knew that my baby were breached, that would be something that I would want to know. And that the success rate of that is about 50%. And so if the baby is not head down, why don't we try to get the baby in a head down position? If someone can manually put their hands on your belly and turn the baby and it not be anything that harms the child, then why not try it? Or why not rush delivery? Because I know that as soon as people start getting up at 40 weeks, they're like, oh, it's time to get the baby out. It's time to get the baby out. I'm like, what's the rush? Baby's not gonna get stuck in there, right? Like, is that what you think is gonna happen? And so I just think, why not talk with the doctor beforehand and say, look, I want to go as long as I can possibly go before we even talk about inducing. And then if the baby's not in the right position, I would like to try to have the baby turned. And I think that if women started out having those conversations at the beginning, then they would have better outcomes, you know? And then even in preparing for a cesarean delivery, let's say that you really do have to have one, then start asking the question of how soon am I going to be able to see my baby afterwards? I've heard stories of people who have not seen their babies for 6 hours, up to 24 hours because of, may have been, oh yeah, I know. And you're separated from your baby for that long. Do you know what that does to the ability for you to bond with your baby, for you to breastfeed your baby? Because if you're latching on right away, that breast milk is, it's going to come. It's like it gets everything going in the right direction. But if you're waiting 6 hours, then you wonder why you have the failed breastfeeding, or why the mom sometimes goes through postpartum depression or feels like she's not bonding with her baby. That separation time is huge. And so I feel like if they could just ask, look, as soon as possible after the baby is born, can it be put on my chest? Can the evaluation of my baby be done on my chest? Because to rip 2 people apart who have been together for 9 months, right? It
I've
just
never
seems
thought
so
about it that way.
inhumane to me. Yeah. And just knowing what kind of medication am I going to be on? Am I going to be too drowsy to interact with my child? I know I talked to a lady the other day and her arms were paralyzed. Like she couldn't feel her arms. And so she couldn't hold her baby. Luckily, of course, her husband was there. He was able to hold the baby and get skin to skin. But I can't imagine that. So I think the biggest thing for me is empowering moms that, number one, if you want to have a C-section, if someone says, oh yeah, I do want to have a C-section, it is convenient. Know the risks. Know that the risks are the same as surgery. You could have blood clots. You could have, your bladder can be affected because it's bladder, uterus, rectum, right? So during the surgical procedure, you could have injury to your bladder, you could have injury to your rectum. Just know that. So then, because sometimes people think, well, when I have a C-section, then I will not have to deal with, right, pelvic floor issues. I might not have to deal with having bladder issues and leaking and constipation. And that's not the case. It's just not the case. And then what if you have a bad reaction to your anesthesia? Or, I mean, so many things could go wrong. You could have hemorrhage afterwards. And it's not that those are not things that could happen with a vaginal birth, because of course, I guess you could have a hemorrhage theoretically, right?
Yeah.
But the chances are higher with a surgical procedure. So.
Wow. So what I took from that was great, was for women to realize that when you go to your doctor and a C-section is suggested, ask questions. It's not the bottom line. And I think for mothers, especially Black mothers today in America, we have to be advocates for ourselves in healthcare, and especially throughout pregnancy. So you can always get a second opinion. from
Wow.
a physical therapist or a doctor, whatever healthcare provider you have, be willing to ask questions and seek out your own research and get second opinions. Because as healthcare providers, we have to earn your trust. So nothing that we say is, or even the doctor says is um, always the end all be all, right? So it's
That's
important for
right.
us to ask questions and to just be informed. Okay, because C-sections are sometimes, there's emergent situations where you need to have them, and then sometimes you could discover other options. So, Katherine, for
Right.
you knew the risk that you had leading up to it, and you're more educated on this and more informed. I'm sure you did your research for yourself, and so you were able to avoid getting one, and you had a home delivery. How was
Right.
that? How was that experience for you?
Oh, girl. So I had both of my babies at home,
Okay.
and the first delivery was seamless. I mean, the pregnancy, the delivery, everything. And he came in 7 hours, and people say, oh, your delivery will be really long if it's your first. And it just wasn't. I feel like because my body was able to do what it naturally was made to do, it happened the right way. And I was able to breathe through everything and just I don't know. The pushing phase was hard. So, you're actually getting the baby out. It was difficult,
I'm
but it
laughing because
lasted.
7 hours sounds like a long time
Oh,
to
no.
me.
Okay. Yes. And so, you know what's funny? Because, yes, girl, don't let people fool you. Okay. The contractions to begin with, they ramp up. So when I first felt them, I was like, oh, is that a contraction? But I knew I'd never felt it before. So it was. And then as the hours went by, it got more intense. But to be honest with you, the contraction started at 11, and I didn't call the midwife until 4 a.m. And so at 4, they came over. She came over. She blew up the pool, filled it up with water. I got in, and at 6 o'clock, my baby was here. And so the pushing phase, or the phase where the baby is crowning or to really trying to come out really close to the opening, is the part that hurts the most. It lasted about 30 minutes. But with this one, what happened was my first baby, he came a couple weeks early, according to the due date, which, you think about it sometimes. I had a lady, and I'm sorry, I'm off track, but she was told that her baby was nearing 10 pounds, and so she had to have a C-section. I've heard moms be told that their hips are too small, and so they'll never be able to get a baby out through there. And I'm like, our bodies are created to do this. And the hormones that are released allow our muscles and our bones to relax and to open up and widen. So, with the right position, with the right healthcare provider there to help you, I feel like you can push your baby out through your own hips, right? But I will say that, I guess back in the day when there were things like rickets and polio, and, you read the research, and with that and the hips being kind of the hip bones being abnormal, that would be different, right? But most people are not walking around with rickets or polio. So why are we talking about their hips not being the right shape or the right size, or, able to accommodate a baby's head to pass through the vaginal canal? So anyway, that's very frustrating for me. But sorry, so this pregnancy, I was supposed to not, she didn't even think I was going to make my last visit because I came so early with my son. But this little princess was hanging around still in there at 40 weeks. And when I went for my visit, my blood pressure was elevated. Now, elevated for me, it was about 130 over 80s. And in order to have a home birth, you have to be under 140 over 90. And so I was asked, or I was told that I might have to have the baby at the hospital. And I cry when I'm happy, but I typically don't cry because I'm sad. But when she said that, just thinking about everything going on right now and with COVID, and I was just like, I do not want to just have one person in the room with me. And in that case, in this case, it would have had to be her so that she could deliver at the hospital where I would have wanted to deliver. So my husband wouldn't have been able to be there. My son wouldn't have been able to be there. It was just a lot of things that I had to take into account when making the decision of, did I actually want to have a baby in a hospital, right? And so anyway, my blood pressure doesn't even sound that bad, right? 130 over 80 something, but for a home birth it was. And so that, plus the swelling that I was having in my feet, and a little bit of protein that she detected in my urine, kind of set me up for what is called preeclampsia, a diagnosis of preeclampsia. And so Luckily, I gave over a sample because when I urinated in cups, she was like, ah, you know what? Let's get another sample and we'll get it sent off and tested. And if you're not pouring protein into your urine, then you can have the baby at home. But if not, we're going to go to the hospital. Well, I sent her my sample and the lab people spilled it. And so she was like, so are you going to give me another sample? She was like, I know you. You're not. I was like, yeah, no, I'm not giving you another sample. And I don't plan to call you or anybody when I go into labor until I'm 9 centimeters and the baby is falling out of my vagina. Okay. And so we could do this the right way where you come over and you facilitate the process, or we could have an emergency situation arise, right? So she's great. She knows me and she agreed to come over and induce. And so she was able to sweep my cervix. Labor wasn't progressing like it was supposed to because I really wasn't feeling anything, no contractions. I mean, I could tell I was contracting, but I knew it wasn't progressing like it did when I had my son. And so I felt the difference. And so that was like at 12:30, she came over to the house. At 2:30, nothing was really happening. So she said, you know, do you want me to break your water? And I said, well, if by 3 o'clock nothing's happening, let's go ahead and break the water. And she was like, you sure? I said, are you sure that if you break the water, this baby's going to come, right? Because in the hospital, they say if the water is broken, baby doesn't come, risk of infection increases. You got to go in there and get the baby out with a C-section if it doesn't. And she said, I have been practicing for almost 3 decades. And I have never broken anybody's water and the baby not come within 2 hours. She broke my water at 3, or she said 2.5 hours. She broke my water at 3 and my baby was here at 5:15.
Oh.
And yes, and she did monitor my blood pressure the whole time. I felt like all she was doing was monitoring my blood pressure, right? But we know how to breathe. We know how to control our pain. We know how to move around. When you don't have an epidural or you're not numb or whatever, you can move around, get into different positions, get into positions that allow your hips to expand and progress labor, right? When you're laying on your back and your hips are on the bed,
Not helping,
right? Who is that
all
convenient for? The healthcare
nobody.
provider. Your legs are, right? The pelvic floor is in the worst position possible to deliver. And then everybody tears and wonders why. It's like if you have 80% of people delivering vaginally tearing, there's something wrong with the process, right? It might just be the positioning. It might be that we're not supposed to be pushing anything, right? When the baby starts crowning, because here's the funny thing, right? The whole time you're laboring, they're like, just relax, just breathe through it, blah, 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 right? But then the baby starts crowning and they're like, push, push, baby's head's there, I can see it. Our adrenaline goes up, we're trying to push, and there goes the tear, right? Why don't we just keep breathing and letting the baby control the birth like it was the whole time? When the baby's way up in the birth canal, nobody's saying to push anything, but the baby is advancing down the canal at its own pace, right? Mom and baby are working together just like they have the whole pregnancy. All of a sudden, everybody tells you to push and everything goes haywire. I thought about that. And so I started asking my patients who were older, like 100-year-old, between 90 and 100, basically. How many children did you have? Were you awake? Because apparently 100 years ago, the moms were actually put to sleep when they went into labor, and then they woke up after their baby was born, right?
Wow.
But here's the crazy thing, not a single one of them tore. I talked to maybe 10 moms over the course of like 2 weeks. Because once you know how you're like, I'm just going to ask, and then all these people start coming to you, patients between 90 and 100 had no vaginal tears. And they were asleep. They didn't have to push.
Yeah. Oh, okay. So you think it was related to them not having to push?
Absolutely. Because we dilate, right? To 10 centimeters. Baby's head's not that much, right? It's not huge.
No, it's not.
The problem is that when you're 9 centimeters, if they're crowning, they're like, go ahead and push. Why not go ahead and keep breathing? Right? And then just let the baby keep advancing. The uterus is doing the work. Can you control your uterus? Like, I can't control my uterus. I mean, do you know what I'm saying? The contractions are happening. They're still happening. So I feel like obviously there is some measure of control, I guess, where, because I know that when I did push, then the baby did advance faster. But I'm like, what if we just slow down? It is painful. It is very painful. So to slow down is hard, but it's possible, right? And I think if someone would talk you through that process, then it would be more common that we're delivering the right way, and that we would have less trauma to our vagina as we deliver.
Wow. I know you just talking me through that makes me think that one day if I have children that I could relax and not rush the process, especially knowing that it can decrease my risk of having tears because I know all the issues that that comes with. Oh,
Girl, and I tell you, I tried not to tear this time. I did. But the baby's head was in the water. We ended up having to move to the water because we found out pre-pregnancy that getting in the bathtub actually, dropped my blood pressure pretty significantly. And because my blood pressure was kind of high when I was at 6 centimeters, she was like, why don't we try moving to the bathtub? So we did. It plummeted my blood pressure. It was great. And then, but when I went to deliver, or when she started coming out, she said, your baby's head is in the water. You got to push. So I went ahead and I pushed, and I felt the tear. So
no.
much so that when she was looking around and she was like, "Oh, it looks like you didn't tear this time." I was like, "No, I did." And she was like, "How do you know?" I was like, "I felt it from the inside out. I felt it." And so I
I don't
could
even want to
tell.
ask how that felt.
You don't want to know, but I'll tell you, the feeling of having that baby in my hands made me forget all of it.
Oh.
It did. It did. But yeah, it felt good to be able to make my own decision. Um, and I think that that's what it is. It is, I would never harm my baby ever. And when we were making this decision, she actually put the baby on a fetal heart rate monitor. I had never had that because the first time, I mean, it's not in the home, or it wasn't in our home. So the first time, my baby was never put on a monitor. Everything was natural. They didn't watch anything. It was just, if I felt good and, was I dilating, it was great. This time, because I kind of felt like I was contracting a few days before I saw her, she wanted to make sure that the baby was fine, getting the oxygen that it needed and everything, and the heart rate was good. And so she put the baby on a monitor, and she said, if the baby makes a 10 out of 10 on the different things I have to look at, then we can talk about a home birth. And she put Crystal Lily, that's my baby's name, she put her on the monitor, and she made a 10 out of 10. And so that was a part of the puzzle. But that's that's what made me feel good. If my baby's fine and I'm still fine, let's go ahead and get the baby out, but it doesn't have to be with surgical, supplies.
Wow. Oh my gosh, I love your story and I love your baby's name. So
Oh, thank
precious.
you.
Wait, how old is your baby now?
4 months.
Okay. Oh, so still so small and cuddly.
Yes, still so small and cuddly. Thank
Yay.
you.
What I know, so we just wrapping up what we have talked about. So moms being advocates for themselves and also moms being more educated about what a C-section is and the risk
Yeah,
factors of having one, but also the risk after having one or because of having one, right?
absolutely.
So if a mother is listening right now and she has been told by a physician or her doctor that she needs to have a C-section, do you have any tips for her to prepare for this procedure?
Absolutely. This is funny. So first of all, I do tell them to watch a video that where they can see the procedure that's taking place. And that way they know what's going to happen to their own bodies. You think about it, you wouldn't go to a movie without seeing the preview, right? Most of the time people wouldn't.
I wouldn't.
They'll go into surgery without knowing what's going to happen, right? So I tell them to do that. I also tell them though to purchase a squatty potty or to take their highest pair of heels to the hospital so that their feet can fit in them if they're not swollen. But really just trying to get their knees above their hips so that it's easier for them to have a bowel movement because that just helps so the rectum and the anus have an angle, and it helps to open up that angle so that the stool can pass easier. Because you can imagine after that abdominal surgery, things kind of slow down. And so you want to be able to have a bowel movement because they typically want you to before you leave the hospital. And you typically have longer hospital stays with C-section deliveries. And so within 3 to 5 days, you should be able to pass stool, but it can be painful. I also tell them, so the squatty potty, I tell them to actually take it to the hospital, okay, with them
Okay.
like beforehand. And then I also tell them to get some silk material. And so it could be anything like what you wrap your hair with, but just to start desensitizing the scar around the scar, because the sensation is just weird. It's altered because when you have clamps put down during the surgery, it can clamp around some nerves that feed into the genital area, right? And so that numbness, that pain, it can be really bad. The sensation can be weird around the stomach. And so you just want to make sure that they're desensitized. And so I tell them to go ahead and get that. If they I also tell them to talk with their doctors if they have a history of keloid scarring, or if they have keloid scarring in their family history, because you don't want to keloid. And so if they can do something during the surgery, like inject something to make sure that you don't heal with a keloid, that's good. But also they can get the conversation going about the use of like silicone strips, because they actually make them in the shape of a C-section, and that, or a C-section scar. And it has the silicone in it, and so you can just put it over the surgical site. It kind of depends on when the doctor says that it's okay. But ScarAway makes them, and then that way they can use that and prevent some of that keloid scarring. I teach them how to do gentle massage around the scar. So like just to think about, because you're not going over the scar for the first 6 to 8 weeks, right? But the fluid needs to move around the scar, so that your lymphatic system gets rid of the toxins that aren't supposed to be there. And with surgery, you can see how you might have increased swelling, and you might have increased swelling just from being pregnant, because toward the end of the pregnancy, typically moms will have some swelling. And so just making sure that they're massaging that area to get some of the fluid out. So I try to get them to just be thinking about that, how to get into and out of bed, just practicing. A lot of the times moms are rolling over anyway, but sometimes you'll see moms and they're muscling up, like trying to sit straight up at the end of their pregnancy. And so I go ahead and teach them how to get out of the bed. And so I would tell them just Google log roll technique, and that way they can roll, get their legs out, push up, so they can be practicing that, so they're not putting strain on their bodies when they go into the hospital. I also have them think about mobility in the hospital and asking for a physical therapy consultation. Nobody's going to tell you to ask for physical therapy, right? So you have to ask for it. Why not? Have help moving after surgery, just like someone who has a back surgery. At my hospital, people with back surgery are gotten up on the same day as surgery. Same thing with a hip replacement. So why is it that moms who are going through surgical procedures are not being given physical therapy to get help to get out of the bed? So I tell them to ask for a physical therapy consultation so that they can have that in the hospital as well. So those are the things that I would tell moms, in addition to making sure that they talk to their doctors about the skin to skin, about the type of medications that they can be on, where they can be awake and alert and able to interact with their baby as soon as possible after the surgery. And just so that they're going in with more confidence, I think, than before. And then the other thing, or then without knowing those things, the other thing I would say is to look at the infection rate at the hospital where they're going to be delivering. And that way they can just, make a different decision if the rates are really high, or if the complications associated with certain doctors are really high.
And make an informed decision to maybe find another doctor or another hospital.
Yes, absolutely. Yes.
Wow.
And go ahead.
No, you go ahead.
I was just going to say, to see the capacity of the hospital to deal with complications, because you know that they're possible. I know that when I shadowed at a hospital that's not the one that I work at. And the reason I did not want to work there was because every time someone came in, if let's say it was a severe stroke, I would do the evaluation. And then the next day I would come in with this, what I thought was a good plan of care. And the patient wasn't there. They're like, oh, we sent him to the medical center. I'm like, oh, okay. And then the next person comes in and they have severe respiratory issues. And then I come the next day with a plan of care and they're like, oh, we sent them to the medical center. I'm like, y'all can't deal with nothing here, right? Not having a baby here, because if there's a complication, then I might have to be driven 30 minutes up the road. What can happen? Do you know what can happen on a 30-minute ride?
A lot.
A lot. So I would say to look at the caliber of the hospital that you're delivering at, and see what is their capacity to deal with things that when they don't go the right way.
Ooh, this is some good stuff. If you need to rewind right now and take notes, please do, because that was a lot, and a lot of golden information that I think literally every mom needs to know. So That was great. So, speaking of, I know you talked a lot about the desensitization of the scar and around the scar, and how you have to wait 6 to 8 weeks until that scar heals before you start to massage over the scar. And I know I looked at the CDC um, in a journal article previously before this conversation, and I saw a stat that like 6 to 18% of women after C-section develop chronic scar pain. So what happens after? What can happen after that 6 to 8 weeks, or what needs to happen to avoid the development of a chronic issue?
Girl, oh my goodness. First of all, I think that people need to know that with any abdominal surgery, they have a 90%, 90% of abdominal surgeries result in adhesions. And adhesions is just a nice way of saying things are glued together that should not be glued together, right? So if you think about it, let's say the uterus is cut, there's a scar there, right? That scar is going to attract scar tissue. Scar tissue loves to touch things. So whatever is close to or whatever is far away, you know, the longer it takes for you to deal with the scar tissue, the stronger the scar tissue gets. So you can imagine if the bladder is in front of the uterus, if the scar tissue attaches to the bladder, then it can cause, I mean, it can cause a lot of bladder issues, but it can cause bladder pain. It can cause bladder leakage, right? Because the bladder is now irritated. And so it can result in you urinating more often. Let's say that the scar tissue attaches to the rectum, then you have issues with constipation, or you can have the scar tissue, or let's say that the scar tissue on the uterus, because of how it is, it stops the uterus from moving the way that it's supposed to, because you know organs are supposed to have a little bit of give, they're supposed to move. And so if it's not moving, you think about the ligaments that are attached to the back, then you have this woman with severe or chronic low back pain, right? And so you, when you think about what could happen, that's just the beginning, right? So the scar pain, you don't even really know where the pain could be, right at the scar, or it could be anywhere else in the body, right? But you just think about locally, if you're just visualizing it, all of the things that are in the abdominal cavity that the scar tissue could adhere to. So that's the problem. And so what I would say is PT should be talking about the scar from before the woman has the surgery, right? Because the nerves are going to be interrupted, and anytime nerves are affected, they take a very long time to heal, right? And so moms should not be thinking, not that they're necessarily anticipating pain, but understanding that the work that they have to do with their scar may take a lot of time. And it may take a lot of attention. And so I would say with the desensitization, you would do that. So the first 2 weeks, I tell them to use something really, really soft like silk. The next set of 2 weeks, and they're just going around the scar, just lightly around the scar, because you'll have some moms who never touch their scar. Some of the time it's because of trauma. Some of the times it's because I'll ask a mom, you know, when's the last time you touched your scar? Well, I was told when I first had the surgery to just like let the soap and water run over it, and then to like pat the area dry. So that's all I like. So that's what they were told. But then once it's healed, then would you not be told something different, right? You kind of need a guide or think to do something different. I released a scar. Well, ended up releasing half of it, but it was 26 years old, and half of the scar was still not healed. It was still open.
What?
I kid you not. And the other half was fully healed. It was wet. You know how when the scars are too moist, they just don't heal. That's basically what happened in her case. And so after we talked about it and I told her what to do and she was able to dry it, it completely healed. But it took time, right? Or completely healed is relative. But anyway, so those second set of 2 weeks, I told them to use something a little bit more abrasive, so like a pillowcase and a cotton pillowcase. And then that third set of 2 weeks, I tell them to use like a washcloth. And then normally, like let's say they go for their 8-week follow-up, and after that, I show them what to do actually over the scar. So around the scar, I would say to do like a circular motion, and you show them, I'm just telling you what I would do because you're a PT and you know, and then parallel to the scar, go side to side, and then move the tissue forward and back. So kind of perpendicular to the scar, but it's all gentle for the first 6 weeks, right? And it's easy to do because I would say, you know, you just wake up in the morning and just, even if it's not even doing those specific movements, just getting your hands on it, right? But then after that set of 8 weeks, because by that time, the scar tissue is maybe at about 50% healed. And so it's, or not even healed. So the scar is healed, after about 2 weeks, you'll see that it looks good, right? But that what lies beneath is different than what you see on
Those
the.
6 layers.
Yes, those you are hilarious. Yes. So they're healing, right? And so the strength of the tissue is what I'm talking about. By that 8 week mark, you're looking at about 50%, right? And then as you keep going, when you think about the way that scars heal in general, they only ever get to about 80% of the actual strength of the normal tissue. And so that's why I think about things like precautions when we say no bending over, no lifting, no twisting, no whatever. It's to protect the incision. And so I've let them know that too. If you're twisting or you're doing any heavy lifting, you are re-injuring that area over and over again, because your abs, you need them. Your core, you need it. And you just had surgery in that area. And so if you would just give it time to rest, because that first 6 weeks, I really believe, is about protection. And if moms knew how to protect their scars, how to protect themselves, then they would be in a better position to take care of their babies, right? But part of protecting that scar is not reaching up into that top cabinet to get something. You're stretching the incision, right? And I do think, though, that when we as PTs sometimes with abdominal surgeons will say, don't lift more than 5 pounds. Well, if your baby's not 5 pounds, they're probably in the NICU, right? So you gotta take care of the baby, or the neonatal intensive care unit. And so your baby may be 6 pounds, 7 pounds, 8 pounds. So why not encourage the mom to have someone help her? So instead of her getting up to get the baby all the time, then maybe have her significant other to go get the baby, or her mom to get the baby and bring the baby to her, so that she's not lifting as much. She's sitting, they're placing the baby on her, and then she's able to do what she needs to do as much as she can. If it's a single mom, then we just have to teach them how to carry the baby safely, right? As close to you as possible. And you get as close to the baby as possible when you're picking the baby up. And that way, you're not putting undue strain on your stomach, on your abdominal muscles. So after the 6 weeks, then we teach them how to go over the scar that they can see, right? So they go over that scar, and then you're looking at the skin layer, though. So if you see my hand, this is my skin, and I can pick up my skin, I can move it, I can roll it. That's not muscle, that's just skin. So we teach them how to mobilize the skin. Then we teach them how to mobilize the muscle layer, and then teach them how to mobilize the organ layer. And so if we can teach them those things, we can get our hands on them and teach them those things, then you're helping the scar tissue lay down the way it's supposed to. Because you think about it, the tissue needs to work, and the blood needs to be able to flow. And when you think about interruptions in that, so the things that can interrupt that is scar tissue. If you have fascia that's been interrupted, because it's part of everything, it wraps around everything. So it's interrupted with the surgery. You're interrupting blood flow, you're interrupting communication between the nerves and the muscle and the brain. It's like things are being interrupted that we can help. So if we can get the scar tissue to lay down the way it's supposed to, then the tissue can work the way it's supposed to, and the muscles can work the way they're supposed to. But it takes daily work on part of the mom. And so you don't want to underestimate the amount of work that she's going to have to put into managing the scar tissue. But if she does that work on the front end, she won't be dealing with complications on the back end. So I would say, if we know the tissue kind of remodeling, it takes place for the first 2 years, I tell the moms, work on your scar for the first 2 years. And so even if they don't, they've done more work than somebody who never heard a scar massage, right? And so
Even if
whenever
they get close, yeah.
Yes. And so I try to tell them the first 6 weeks, you're doing it twice a day for 5 minutes, in the morning and at night. You're doing something to your scar, right? And then after that first 6 weeks, then you're going to start over the scar, and you're going to do the same thing, 5 minutes in the morning, 5 minutes at night. Just do it for the first month, let's say. And then after that, just do it weekly and check in on your scar. Because if you talk to moms who have C-sections, sometimes they'll be like, man, I felt really, really bloated, or I felt like I had a lot of fluid around my stomach. And then once they do the scar massage, you can imagine, right, that fluid is able to leave happily through the lymph nodes, and then they're not as swollen anymore. And so I just think if they would put in the daily work and know what that daily work is, or it becomes weekly work. And then after the first year, I would say do it once a month. Just check in on your scar, do that same massage, 5 minutes at night, right? And you just do it once a month and see what happens. And that way they're constantly helping with the remodeling process. as opposed to 20 years down the road, they have leakage, they have a lot of scar tissue buildup, and they don't know why. And then you think about it, maybe it's 2 years down the road and they have to have a repeat C-section, right? Now the doctors are having to cut through scar tissue. Now you're under anesthesia longer because the surgery takes longer because they had to cut through so much scar tissue. We could help them remodel that. And so that's what I would say. Scar remodeling is a process, and we can help them with the process starting from before they have the baby.
That's great. So it's a process, it's a journey. It's longer than one might think it should be. But I think that if you have the right teacher, the right physical therapist guiding you through their journey, it doesn't seem like it's that hard to do. And the benefits definitely outweigh the time.
Yes, yes, right. And then what I would say is if you develop adhesions, then you can get into more, advanced techniques where PT actually has to be the one, or not has to be the one, but can do the release of the scar tissue. And then the mom just takes over from there. So I'm able to teach them how to do it on their own. But I feel like that a lot of the times wouldn't even have to happen if they were taught what to do within the first 8 weeks and then the first 12 weeks, really.
Right. So as women, as mothers, we have to be more educated about what's happening to our bodies. Like you said, which was very great. You don't go to a movie without seeing the preview. So research what a C-section is and what's happening to your body. Advocate for yourself and make sure that's the if that's the only option for you, or if you can find better options. And then do your homework beforehand. So whether it's, rearranging your nursery so you don't have to do much bending and lifting and reaching, right? To prepare, to protect that scar as it's healing. And then also, realize that it is a journey and that you got to keep working on that scar for a couple of years just to make sure you don't develop that chronic pain that a lot of women do develop.
Yeah.
So great. Okay, and then you kind of talked about how PT can help. Can you talk about your program, your Rediscovering Your Music, just a little bit more, and how it has helped women after C-section?
Oh, girl, I tell you, I love working with moms, number one. But I will say this. I think that, so a mom in particular, one mom in particular that came to mind when you said that, when I walked into her home, because I see moms in their homes normally 3 to 5 days after they've had their baby, or 3 to 5 days after they're released from the hospital, excuse me, because I teach them the things to do when they go home so they protect themselves until they see me. And then I just make sure that things are progressing like they're supposed to, because we can detect if someone has, is hemorrhaging, or their blood pressure goes up too high or down too low, or they have swelling that's abnormal, or they have a blood clot, or just screening for those things, because then you can stop things from happening that that could otherwise be life threatening, right? And so with my program, I typically will go out, and because it is scheduled, so then I know when I can go and see them, because we typically schedule it about 5 days after they have left the hospital, within 3 to 5 days. And this lady, though, I walked into her house and she was sitting down in a very deep rocking chair. And normally, SPTs, as soon as we see moms, we're assessing them, right? So she didn't walk to the door. Her husband was one that opened the door. I get in, I see her in this deep chair. She gets up to hug me, and she pushes up with her arms, thrusts her pelvis forward, and then pulls her upper body afterwards. And I was like, I am in the right place, right? And
You
so I was
need
able to
me.
teach her the better way to get out of the chair. And she, immediately was like, that felt so much better. Like, I don't even know why I was doing it that way. It was just, it seemed like it was easier, right? But when we teach them what is actually easier, it feels different. And then from there, her posture, when she stood up, her shoulders were rounded. I was able to show her some exercises to kind of open her chest back up. Because you think about it as moms, when we're either breastfeeding, bottle feeding, changing the baby, everything is closing our shoulders down, our neck is forward, our head is down. And so we end up with the headaches, upper back pain, or we could, but with intervention, we don't. And so I taught her some exercises, stretches for her neck, some just gentle exercises for her back. And then I asked her to walk to her bedroom and show me how she gets into and out of the bed. She was walking to her bedroom with no hip rotation. She was walking like a penguin, right? And so I said, why are you, girl, walk like you would walk if you were trying to get your husband's attention, right? And then she was like, oh, and she started doing it and she realized how much better that felt, right? And then I watched her get into the bed. She kept talking about how painful it was to get into and out of the bed and how, because I do a really in-depth consultation before I even see a mom, because I feel like some moms may need me and some moms may just need PT. It may not be the right fit, right? But so I do about an hour-long consultation and I give a lot of information that I feel they would benefit from, so that whether they work with me or not, they're still empowered, right? And so she was getting into the bed anyway. It was an interesting way of getting into the bed, let me just say that. And so was able to teach her the right way to get into and out of the bed. Her situation was unique because the only bed that she could sleep in was pressed up against the wall. And so the way that she was needing to get out of the bed, I was able to teach her, and that was great. And then, you think about I think, how like if you're in a relationship, you don't talk for 9 months. You may have the best intentions for that relationship, but it might not work because you haven't communicated with each other in 9 months, right? I try for moms to kind of think about that with their core. So if your core has not been working the right way for like the last few months of your pregnancy, then you can't expect that it's just going to go back to normal. So I'll hear moms say, I just feel so disconnected. I feel like my stomach is acting independent of the rest of my body. And so during that first session, I teach moms how to coordinate their breathing again with their pelvic floor muscles and their deep abdominal muscles, how to use their deep back muscles, because sometimes moms just need to learn how to breathe again, how to breathe the right way. If your diaphragm, everything was really pushed out of the way to accommodate the baby, right? So then all of a sudden the baby comes out and moms think that everything's supposed to go right back the way it was, and it just doesn't. And so that first visit is all about retraining those muscles to communicate with each other again. And so I visually inspect the pelvic floor. Obviously, I do not do an internal exam when they first come out of the hospital, even if they've had a C-section, but I'm able to see. And a lot of times all they have is a quiver. Why? Because the pelvic floor has still done work. It's done all the work, the whole pregnancy. Just because you didn't deliver vaginally, that doesn't mean that your vaginal muscles were not affected, right? And then with the nerves being affected that give sensation to those muscles that are inside of the pelvis and control your urine and control your bladder and bowel and control your the sensations that allow you to experience pleasure with sex and have orgasms, all of that has been affected, right? And so I look at the pelvic floor visually, and then I have a mom do a contraction. And if she can't see it, then I have her use a mirror and just know what she's supposed to be looking for. So I teach gentle pelvic floor exercises, gentle abdominal exercises, nothing like, because when I say exercise, I don't want you to think crunches and stuff like that. No, it's just communicating with your abs again. And so a lot of it is breathing. A lot of it is just very gentle contractions. So I teach them some things to do at their home for the first 6 weeks. So I just come that one time, teach them everything that they need to know. And then at that 6-week, 8-week mark where they're told that they can return to activity by their OB, then I make sure that I check for a diastasis, make sure that their abdominal muscles are not separated, or if they are, because sometimes they still are at that point, teach them more progressive exercises, make sure that their shoe wear is okay, because sometimes foot size changes with pregnancy, right? Make sure that their bra is fitting properly, because they may be breastfeeding and not thinking about supporting their breasts the way that they need to be supported. And then looking at the activities that they want to get back to doing and seeing if it's the right time, right? Because if by 12 weeks, the abdominal core muscles or the incision is healed, is on the right track for healing, then why is it that at 8 weeks they're told that they can go back to work and be lifting? And I had a nurse, she went back to work after a C-section. She was leaking so badly when she reached out to me, and I talked to her and I was like, light duty. ask for light duty. You're not ready. Your core muscles are not ready, right? Your pelvic floor muscles are not ready. And she didn't have any therapy afterwards. She just came up to me and asked me a question because she heard about what I was doing. And I was able to talk with her and just teach her how to protect herself while she's at work. And so that's what I do. I help moms, number one, prioritize themselves. Number two, desensitize their scar and kind of get it ready. Mobilize that area, the pelvic floor and the core, realizing that the core is not just the abdominal muscles, right? And sometimes we have to silence some of the abdominal muscles or kind of people say down train, teach them how to relax. Because if you're just, let's say that you go back into CrossFit or you go into any type of high intensity exercise program, a lot of times you're overriding those smaller muscles. You're using those larger muscle groups and you never get down to the nitty gritty. And so you see moms with a C-section pooch, or they call it that. I would never call it that. C-section pooch, a C-section shelf, where basically the top of their abs are flat and the bottom is just, looks like they're still pregnant. It's because the muscle that is the core sitting muscle is deep and it has to be trained specifically. And a lot of times that is not done in a group class, right? You need someone to look at you and say, these are the exercises that you should do. These are the ones that you might want to put on hold right now. I remember a lady saying, I was told I could never do planks again. I was told I could never do sit-ups again. I was told I could never. I'm like, no, you just have to progress to it. There are some people who, if they never did a plank, they would never get their stomach back the way it's supposed to be, right? But can we modify those planks? And that's a lot of what I do is teach moms. I look at them all throughout the house. How are you holding your baby? How are you getting into and out of the car? How are you getting into and out of your bed, up and down from surfaces? What are you doing while you're making the baby's bottle? Is it that you could just be doing a few gentle pelvic floor contractions throughout the day? It's not about doing an exercise routine. If you have a baby, you realize that sometimes that's just not possible, right? But you can throughout the day, if you're walking through the doorway, do a stretch for your chest muscles, right? Or if you're sitting down and you're breastfeeding your baby, grab that water, make sure that you're hydrated. A lot of what I do is making sure moms have the energy to do what they need to do, because a lot of times you'll notice that moms who breastfeed or moms right after they have their babies, they're not eating right. And so they don't have energy. And a lot of moms are just like, I just don't have the energy that I used to have. You look at their diet and they're consuming 900 calories. Well, you probably need a lot more than that, right? And then if you're breastfeeding, 500 plus calories on top of that. And so just looking at their diets, looking at how they're hydrating, making sure that they're taking care of themselves. It's a really big part of what I do, because I feel like moms, they lose themselves sometimes when they have their babies. And so you might ask them 10 years down the line, what do you like to do? And they don't even know anymore, right? And so I feel that the physical is really, really important, but I also feel that a big part of what I do is give moms emotional support, because sometimes their self-esteem is affected because of, it could be because of the scar, it could be because they feel like they can't lose their belly fat, or it's taken them a really, really long time. And I just like to let moms know, if you carried a baby for 9 months, give yourself at least nine months to recover, right? Now, you have to put a concerted effort, though. The problem is that after you've had that C-section, it takes more work, right? But the work can be done. You just have to take it slow and steady, and don't try to speed through the race, because if you do, then you are just overriding the very muscles that you need. Very rarely do I go to a gym and see someone laying on their stomach working their low back muscles or working their deep back muscles, right? They just don't. And so in the same way, you can override the muscles that are in the front that you really need to achieve the results that you want. And then the other thing I'll say is sometimes moms trap emotions in their scars. So like I've done a scar massage before, and a woman, like, she just started crying. She felt like she was back in the operating room. She said she could taste the metal on her tongue, right? And so once that was released, though, she felt so much better. I've had moms call me. I had this girl scream into my voicemail. She goes and gets waxed all the time. And, like I said, that area can be sensitive, but we still want to look good, right? So she goes and gets the wax. For the last, her child was 9 years old, I think, when I did her scar release. And she was talking about how painful the waxes normally are. So we did the scar release, and the scar, it was painful for her. And I tried to make it as painless as possible, but it was a painful experience, unfortunately. And it's not always, but it was for her. I think that it was both emotional and physical, right?
Mhm.
But anyway, after the scar was released, she called me the next day yelling into my phone. She was like, I went to go get a wax and I did not have any pain. Oh my gosh, who knew scar tissue could screw you up like that, right? And so I don't know, it's just amazing. And then I was just reading a testimonial about a lady who she was having pain with sex, and her husband wasn't really happy about her going to spend money on getting a scar release done. But after the scar release, she had pain-free sex and an orgasm for the first time in years. And
Wow.
he was like, oh, you can take as much money as you need for your scar release, right? Because I'm like, I
Yes.
think the thing about guys is that they don't really understand the trauma that a woman's body goes through. And so maybe we try to rush back to doing things like we were doing them before. But I think that if the guys knew more, maybe they would do more, right? And then it can
Hmm.
make it easier on the woman to heal. And so that's part of it too, is just teaching the husbands or significant others or families what their role is and how they can help in the recovery process. So I guess when you ask me what I do whatever the mom needs. And I think that that's what's necessary. We cannot treat moms like they're on an assembly line, right? I remember I hear moms all the time and they're like, yeah, I was just told to do Kegels. I was told to do Kegels. I was told to do Kegels. And it's like, what does Kegels have to do with your C-section? What is Kegels? I mean, not that they're not related, right? Because they are, but Kegels are not
Solve
the
everything.
answer for everything, right? And then it's what position are you doing those Kegels in? Are you doing them in the positions that are actually challenging your body? That's why you see moms or challenging those muscles. You would never expect your child to get to multiplication or the higher multiplication tables if you never expose them to it, right? So why do moms expect that they can go jumping on a trampoline and they've never trained their pelvic floor muscles to endure that? Or go back to heavy lifting and they never train their core abdominal muscles to support them in doing that. And so I think that part of it is us showing moms how to progress themselves, because I like moms to be empowered. And so a lot of the times when I give them exercises, I go ahead and show them the modification. So once this gets easy, reach out to me and then I'll let you know if it's time to advance. If you notice that your form is failing, because that's what I see a lot of moms do. If they were doing planks before for 2 minutes, they jump right back into trying to do them for 2 minutes. Why don't we try, instead of doing them on the floor for 2 minutes, why don't you try on the wall, planking on the wall? Or why don't you try from there going to the table, and then
Hmm.
from the table possibly going to the floor on hands and knees and just holding your stomach up against gravity, and then maybe get into the more advanced plank positions. But never put yourself in a position where the contents of your abdomen are pushing through your abdominal muscles through the wall, because if they are, then you're setting yourself backwards every time, and then you wonder why 10 years down the line you still look pregnant and the rest of your body looks great, right? You see those women, they're toned in their arms, toned in their legs, everything looks great, and they still look like they're pregnant, right? We can help with that. So, and that's what I like doing, individualizing treatment care plans for moms and empowering them to progress it on their own. And then if they need me, they reach back out. And if they don't, they don't. But for the most part, they'll reach back out, but to say thank you, right? But
Yeah.
it takes a while. It takes work. But moms, we do the work. We do the work for our babies. We just never been taught to do the work for ourselves. When I wanted to go and teach at the different hospitals here, yeah, I told them, hey, I would love to come teach this class for free so that moms know how to prepare for C-sections, know how to prepare for vaginal births, know how to take care of themselves afterwards. And they were like, no, mom's already overwhelmed with information. We don't need that. They need that,
They
right?
need it.
They need it so they can take care of themselves, so that they can take care of their babies.
And this is why, Katherine, I just love you so much. This is why we are
Mhm.
talking right now and we're having this podcast to get the information out there, because it's not out there. And I liked how you talked about not only educating the mother, but also their spouse. And I also liked how you talked about the emotional part of it all, because I think as women, you're natural, just nurturers, and you're thinking about your baby in that time because that baby needs you for literally everything. But you also have to think about yourself, and it's not being selfish at all. And I don't think women should have to choose between taking care of themselves and taking care of their babies. We
Say
can do it
that, girl.
all, and you can get your husband or your partner, on board, and the rest of your family, because it does take a village and it takes time. And if women are more educated and their families are more educated, then you can set those expectations in the right way. Because those who are not educated, you don't have the expectations, and you're thinking that, well, I had this baby, my scar is healed, why am I not like I used to be?
Yes. Yes.
Oh
Now,
my
you said something earlier that about advocating for ourselves, especially as African American women, and I wanted to speak to that because for this last pregnancy, after I had the baby, people tell you that the cure for preeclampsia is delivery. So basically, you deliver the baby, and the expectation is that everything kind of goes back to normal, right? But what I found in talking to a lot of other moms and what happened with me is that things actually got worse after I delivered. So my blood pressure actually went up to, it was very high in the 190s over 110s, like it was pretty bad. But what was frustrating was that when I went to my doctor, he accused me of having high blood pressure before, even though he had access to all of my records, and my blood pressure normally runs hundreds over 60s. But he was like, you're African American, you're in your 30s, so you're getting old. You probably eat a poor diet because you're in the South. And then when I told him, he asked me if I had a way to monitor my blood pressure at home, and I said, yeah, because I do. I said I have a couple of monitors, and he was like, oh, so you must have seen this coming. You must have had high blood pressure before. And I was like, no, I'm a PT, and I go into people's homes and I take their blood pressure. But he had already had it in his mind that, number one, I had this beforehand. I had blood pressure issues beforehand. He also felt like I was going to be put on medication and never get off, and that I was not going to be able to recover. And so before every visit, I talked to my really good friend who's a doctor. She's an MD. My other friend who is a pharmacist. And then I talked to my friends and family very close, like kept this very close to the chest, I guess. I didn't really tell a lot of people, but the people that I did tell prayed for me every day, every appointment. When I tell you, after 2 weeks, I was off the blood pressure medication. Obviously, I was already eating a good diet. I was making sure that I was moving around. I was told to go on bed rest, just go on bed rest and just wait for things to calm down. And I was like, that's not the way that the body works. You go on bed rest, and that's never fixed anything, right? And so it was decisions that I had to make that in the midst of scary vital signs, right? But there was a PT, and she reached out to me after I made a little post in a mommy group that I have just about the experience that everybody had kind of followed me along my pregnancy journey. And so I didn't even say much. I just said, I had some issues with preeclampsia or whatever. She reached out and she said, I'm going to tell you something. You are in Macon, Georgia. You will go to doctors who think that this is who you are. And you have to understand that your vitals do not define you. Your diagnosis does not define you. So what you're going to do is you're going to get out there, you're going to walk a little bit each day, listen to your body, do not overdo it. Do what you would tell a mom to do. Monitor your blood pressure. She said, but take it just like you're brushing your teeth. Don't worry about it because you'll have that anxiety attached to it and it might be higher, but it's not it might not, so may not supposed to be that way, but because of you're anxious, it will. So just act like you're brushing your teeth. You brush your teeth in the morning and you brush your teeth at night. Take your blood pressure in the morning, take your blood pressure at night. She was like, make sure that you're getting enough sleep so that your organs have time to heal, because you know that with preeclampsia, you can have kidney impacted, and so you got to have enough time to sleep. And with newborns, you may not sleep if you're breastfeeding. So she was like, pump a bottle, give it to your husband, you sleep through that night feed, make sure that you're getting your 5 hours, say no to things that stress you, and you will be okay. She was like, watch yourself heal so that you can teach other moms that they can heal. And girl, when I tell you I got off the phone with her, I did exactly what she told me to do. My blood pressure, I took it this morning, was 104/67. Yes, yes. But I did leave that clinic. Initially, I kept going back because it was convenient. It was like I knew that they would take me. I knew that they knew exactly what was going on with me in terms of like I knew that I could get in there because with COVID, a lot of time, people weren't taking new patients and it might take a little while. But as soon as I realized that going there was the stressor, I was like, you know what? I don't have to go there anymore. I'm a PT. And I know that my issue now, all that I have going on is my kidney problem. So why don't I go to a kidney specialist? So I remembered a doctor at my hospital that every time I read his notes, he's thorough, super smart, has his own clinic. I reached out to him. He was like, come on in. Don't need a referral. Just come in directly. I did that, learned about my kidney function. I'm going to follow up on it for the next year because research tells you that if you've had preeclampsia, then 5 to 15 years down the road you may have issues. And I wonder, then why do you stop following up with moms at 6 weeks, right? You either put them on magnesium sulfate in the hospital, typically if they're going to have a C-section because of the preeclampsia. They put them on that, put them on blood pressure, and send them home. And so it's blood pressure medicine, send them home. After 6 weeks, of course their blood pressure is down because they're on blood pressure medication. And then after that, there is no follow-up. Not a single mom that I've spoken with who had preeclampsia, who ended up having a C-section, knows anything about their kidney function. Why not? If the kidneys were affected, right? And so for me, I feel like having a healthcare provider with you is such a good thing. Every visit, or let's say on every follow-up visit, right? So that you can ask the right questions, make sure that things that are checked, that need to be checked, are actually checked. For my follow-up, my 6-week follow-up, and I hate to say this on camera, but there was no touching other than my knee. No vaginal, no vaginal examination, no check for prolapse, no check for tenderness in my stomach, no check for abdominal muscle separation. A tap on the knee saying, wow, you look a lot better than you did the first time when you came in the first visit.
Wow.
We have to have somebody with us to speak up for us. And we have to have the courage to move on and find a provider who actually cares to listen to us and get to know us and treat us like an individual. And so I would say to all moms who have C-sections, moms who have vaginal deliveries, make sure that you're getting the care that you need. Make sure. And it's not always just an OBGYN. There are urogynecologists who are super helpful, super smart. And a lot of people don't know anything about them and how they can help them. I talked to a mom who was told that she had a rectocele, so her rectum was basically pushing onto or down from the original position and pushing into the vaginal canal, and she was having some issues. And they were like, "Oh, it's just a moderate rectocele. You're fine." And she got sent back home. And I thought, wow, it's the same thing that's happening with moms who are saying, "My scar is still hurting. My scar is still itching. I'm numb. I'm having pain with sex." Nobody says anything. Seek help. Listen to podcasts like yours so that we can be informed and so that we can be fearless when we have to make the decisions that are best for us.
Yes. That was so powerful. Thank you for sharing your story with us about
You're
what you
welcome.
went through. And I'm glad that you were able to advocate for yourself when you had people in your circle. You had a tribe of women to support you and empower you through that journey, because I know that
Yeah.
has to be scary. Um,
Yes, yes, yes,
but
yes.
and I mean, that's a testimony to anyone to know that, you need those people around you to help support you in times where you're having difficulty supporting yourself. Um,
Yes,
so I'm glad
yes.
that you were able to share so much information with our listeners.
Thank you.
I think everybody who listens to this is going to leave well more informed than they were before they listened. And I
Yes.
think that if everyone who listens can share it to at least one friend, one mother, then we can kind of keep this journey of being educated and advocates for ourselves and, just being more empowered women. We can keep it up, keep the momentum.
Yes. Yes, thank you.
Yes, thank you. How can people reach out to you if they want to know what you're doing, or if they want you to serve them? How can they get in contact with you?
I would say the easiest way, honestly, is my cell phone. And so they're welcome to have my number at 770-354-1013. They can always call. I always love to help moms, whether they use me or not, because sometimes people call me from out of the state. I don't practice out of the state. Still have an hour-long consultation and tell them there are some things in your diet that you could eliminate. There are some things that you could be, whatever. Just teach some things that I can over the phone. But I also have a Facebook page and it's called Rediscover Your Music. And it gives a lot of free information about everything. Just go into the search and type in whatever you're looking for, and it's probably there. And if it's not, then just send me a direct message. And then I also have a website, rediscoveryourmusic.com, and that's where they can get a lot of information as well.
Great. Oh my gosh, you're everywhere. I love that. The versatility.
Oh, thank you. You're so sweet.
Oh.
Thank you.
Oh my gosh, this has been such a great talk. I thank you so much for taking the time out of your busy schedule, serving women and serving your family to talk
Oh,
with us and educate us. I feel like I've learned a lot today.
thank you. I learned a lot from listening to you and talking to you even before this. So I appreciate you. I'm so proud of you, ladies. Empower women, empower women. Yes, I love it. And I'm so grateful for what y'all are doing because moms need it. I think now it's just an awareness thing. People being aware that your podcast exists and that other podcasts exist where they can get good quality information. Because if they look to the internet, you can get the wrong information every time. Um, you just can. And I think that having people who have education in this and have experience in this, talking directly to you, like there's no price that you can put on that. And the crazy thing is that podcasts are free. So just listen, right? Yeah.
Such a great free resource. So I'm just happy that this is going to be out there for more people to listen to. And thank you for sharing your information. So if anybody wants to contact Dr. Katherine Sylvester, she was so open to share her cell phone number and her website, Rediscover Your Music. So thank you again for letting me interview you, and thank you for sharing all of your knowledge with us.
Oh, thank you. It's my pleasure.